Early detection and treatment plays a big role when it comes to survival rates for women diagnosed with breast cancer. When it comes to some standard radiation techniques, though, it can be pretty tough on patients who have to undergo weeks of daily treatments. But a new FDA-cleared treatment method that's been developed by doctors and scientists at University of Maryland School of Medicine is giving patients an alternative that could cut down radiation treatments from weeks to days. And here to tell us more is Dr. and Assistant Professor Elizabeth Nichols. Welcome to the show, Elizabeth. It's great to talk to you.
Thank you so much for having me.
My first question is just an overall, how have the treatment options changed over time for women with early detection of breast cancer?
Treatment options for women with early-stage breast cancer are changing pretty rapidly over the last several years in our country due to the fact that the cure rates for early-stage breast cancer are so high. So researchers and scientists both here at the University of Maryland Medical Center as well as elsewhere are really focusing on how can we make treatment more convenient for women by making it shorter, by improving both short-term and long-term side effects, as well as to maintain good cosmetic results, meaning how the breast looks after radiation treatment. And so the development of the Gamma Pod is really in line with all of these things.
What is the Gamma Pod?
The Gamma Pod is a new radiation therapy device that was developed here at the University of Maryland School of Medicine. And what it does is delivers radiation therapy with pinpoint precision to the highest risk area, which is usually the area where the tumor was located, with almost no radiation dose to other parts of the breast, as well as the heart and the lung, two of our major vital organs. It also delivers the radiation therapy in a shorter time frame, so it takes treatment from weeks down to days and can be delivered in as few as 1 to 5 treatments. The treatment starts with an immobilization, a custom fitting of the breast, where women are laying on their bellies in the prone position. And we take advantage of that because when women are laying on their bellies, it pulls the breast tissue away from the ribs, the heart, and the lung. Women then undergo the radiation treatment planning as well as the delivery all in one session. And from start to finish, it takes roughly 1.5 hours.
This is amazing. The video that just showed is fascinating to me. Was this something that researchers said, hey, the need is out there, and then they started developing it? How did this development come about?
This development came about due to the fact that, again, the cure rates are very high, and there's really been a thought that for a lot of women with early-stage breast cancer, we're probably giving them too much treatment that they don't actually need. And so that was really the impetus for developing the Gamma Pod. And so again, the Gamma Pod really focuses in on the highest risk part of the breast instead of treating the entire breast with radiation. And what we're also seeing is less short-term side effects as a result of that. So women are seeing less fatigue, and we're also seeing a lot better skin reactions. So we're not seeing severe skin reactions, which we sometimes see with regular treatment.
Wow, this is brilliant. So you're seeing less side effects for the patients. Side effects obviously are something that are detrimental to the patient's psyche and everything, but what about the actual effects on the cancer and the tumors? What are you seeing there?
So in terms of effects on the tumor, we're actually seeing that the cure rates are the same still. So again, because the cure rates are so high, we don't expect the Gamma Pod to improve upon that, but to maintain those. And so we are seeing that. So we're saying that the treatment is very effective and, like you said, really improving treatments, which is improving women's quality of life.
This is amazing. How do our viewers find more information about this, or try to find a place where they can use it?
The treatment right now is only being offered at the University of Maryland Medical Center, and patients and their families can visit umgcc.org/GammaPod for more information.
Thank you so much for your time, Dr. Nichols. Have a great day.